Hello and welcome. Today, we'll be discussing autism spectrum disorder with intellectual impairment, a complex neurodevelopmental condition that affects many aspects of a person's life. We'll explore what it is, what causes it, how it's diagnosed, and what can be done to help individuals living with this condition. The exact causes of autism spectrum disorder, particularly when accompanied by intellectual impairment, are not fully understood. Research suggests a complex interplay of genetic and environmental factors. Genetic predispositions, including inherited genes and spontaneous mutations, play a significant role. Environmental factors such as advanced parental age, certain prenatal exposures like infections, or complications during pregnancy and birth may also increase the risk. It's crucial to remember that autism is a spectrum, and the specific factors contributing to the condition vary from person to person. The pathophysiology of autism spectrum disorder with intellectual impairment involves differences in brain structure and function. Studies have shown variations in brain size, connectivity, and activity in various regions, including the frontal lobe, temporal lobe, and amygdala. These differences can affect social interaction, communication, and behavior. At a cellular level, disruptions in synaptic function, which are the connections between brain cells, and imbalances in neurotransmitter systems are also thought to play a role in the manifestation of autism with intellectual impairment. Epidemiological studies indicate that autism spectrum disorder affects approximately 1 in 54 children in the United States. While the prevalence of autism itself has been increasing, it is important to understand that changes in diagnostic criteria and increased awareness contribute to these figures. Autism spectrum disorder with intellectual impairment accounts for a significant portion of those diagnosed with autism. It affects individuals across all racial, ethnic, and socioeconomic groups, but some research suggests possible disparities in diagnosis and access to services among certain populations. The signs and symptoms of autism spectrum disorder with intellectual impairment are diverse and vary in severity. Core symptoms include difficulties with social communication and interaction. This may manifest as challenges with understanding social cues, initiating and maintaining conversations, or forming relationships. Repetitive behaviors and restricted interests are also characteristic. These might include repetitive movements like hand flapping or rocking, intense focus on specific objects or topics, or adherence to rigid routines. Intellectual impairment is evidenced by significant limitations in intellectual functioning and adaptive behavior, impacting everyday tasks like self-care, communication, and social skills. These symptoms are usually apparent in early childhood. Diagnosis of autism spectrum disorder with intellectual impairment is typically a multi-step process. It begins with developmental screening, often performed by pediatricians during routine checkups. If concerns are raised, a comprehensive diagnostic evaluation is conducted by a team of specialists, including psychologists, psychiatrists, neurologists, and speech-language pathologists. This evaluation involves observing the child's behavior, assessing their communication and social skills, and evaluating their cognitive abilities using standardized tests. Adaptive behavior is also assessed to determine the level of intellectual impairment. It's crucial to rule out other potential conditions that may present similar symptoms. While there aren't distinct subtypes of autism spectrum disorder with intellectual impairment in the same way there are with some other conditions, the severity of both autism and intellectual impairment is often classified based on the level of support needed. This ranges from requiring support in some areas to needing substantial or very substantial support in all areas of functioning. Understanding the level of support required is crucial for developing an individualized intervention plan. Currently, there is no cure for autism spectrum disorder with intellectual impairment, but early intervention and comprehensive treatment can significantly improve outcomes. Treatment focuses on addressing the individual's specific needs and may include behavioral therapies like applied behavior analysis, ABA, speech and language therapy, occupational therapy, and social skills training. Educational support is also vital, including individualized education programs, IEPs, in school settings. In some cases may be used to manage co-occurring conditions such as anxiety, depression, or hyperactivity. The goal of treatment is to enhance communication, social skills, adaptive behavior, and overall quality of life. Currently, there are no definitive ways to prevent autism spectrum disorder. However, certain strategies may help reduce the risk. These include ensuring adequate prenatal care, avoiding exposure to harmful substances during pregnancy, and maintaining a healthy lifestyle. Genetic counseling may be beneficial for families with a history of autism or other neurodevelopmental conditions. Further research is needed to identify modifiable risk factors and develop effective prevention strategies. The prognosis for individuals with autism spectrum disorder with intellectual impairment varies widely depending on the severity of the condition, the intensity of early intervention, and the availability of ongoing support. With appropriate intervention and support, many individuals can achieve significant progress in their communication, social skills, and adaptive behavior. Recent research is focusing on identifying biomarkers for early diagnosis, developing more targeted therapies, and improving our understanding of the underlying brain mechanisms. Advances in technology, such as assistive communication devices, are also playing an increasingly important role in improving the lives of individuals with autism. Research into genetic causes continues, with the hope of one day developing personalized treatment plans based on an individual's genetic profile.